What if we didn't have to talk about our problems and our mental health problems endlessly? That's where art therapy comes in. Art therapy is this really cool modality for in the mental health space, and we're going to unpack all of it. Today we're going to cover, what is art therapy? Who practices art therapy? Who is art therapy good for? How does art therapy work? And commonly searched for questions when it comes to art therapy. Hey friends, it's your good friend Tim Campbell-Smith, and today we are talking about art therapy and how it can be used in mental health. Now, before we go too far, I want you to make sure you like and subscribe for all things mental health, business, school, life. Now, an important disclaimer I have to make right out of the gate. I am based out of Ontario, Canada, and in Ontario, art therapy is a controlled act. That means it is legislated by the government, that there are specific laws and very specific requirements. So the way I'm talking about art therapy is in line with those legal requirements and some of the legalities or the legal considerations when it comes to art therapy. Okay, so let's start here. What is art therapy? I'm going to use a quote to make sure I get this right. This is from the Ontario Art Therapy Association. Art therapy is the use of arts and creative modalities in a therapeutic way to support a client's goals and well-being. So let's quickly recap, though. What is the definition of therapeutic? Because that gets thrown around a lot. Therapeutic is anything that is helpful in healing to a person. So then back to that definition, art therapy is the use of arts or creative endeavors in a therapeutic, which is a helpful healing way. So I find the easiest way, especially for new folks who have never heard of art therapy, the easiest way that we can compare art therapy to is talk therapy, because most people are familiar with talk therapy. Talk therapy involves usually sitting down with a therapist and talking about things and using words and verbal communication in a therapeutic or a helpful healing way for the person's mental health or well-being. The key thing with talk therapy is it's about words, verbalizations, and conversations, and everything that happens within a conversation or with words, with verbal and sometimes non-verbal cues and practices. Art therapy uses art and creative endeavors as part of that process. So in an art therapy session or with an art therapist, you are actively using arts and artistic modalities and artistic things, creative things to express thoughts, feelings, emotions, whatever you're experiencing, and to reflect on and to make the whole process therapeutic or helpful or healing. So if you've never experienced art therapy, here's a few hypothetical situations that you may experience with art therapy to highlight how they're different from, say, talk therapy. So for example, you might go to an art therapist because you're not quite sure what's wrong, but you're feeling just general sadness, you're not feeling as motivated, you're kind of struggling with some things in life, and you're like, I don't know what's wrong, but something ain't right. So you go to an art therapist, and the two of you might agree to bust out some paint. So you bust out some paint, and they give you some canvas and some paintbrushes, and you just start painting. And both you and your art therapist notice that you're painting with shades of blues and purples and very dark greens. So you start to discuss, why are you painting with those blues and those purples and those dark greens or those blacks? What does that mean to you? What does that reflect? Why are you creating what you're creating? So the art is kind of expressing what's going on internally, but it's also something to reflect on and to use to forward that conversation. I do want to take a quick side note here and say that art therapy isn't without conversation. It's not completely devoid of conversation. It's not like a total opposite to talk therapy, but talking isn't the first and only modality used. In this case, in this first situation, painting is. Here's another situation you might encounter with an art therapist. Say you're really struggling with a really big life decision. Do you quit the job or do you not quit the job? And you're really struggling with how to make that decision. So your art therapist might use art as a way of teaching you how to break down problems into smaller bits. to learn not only problem solving skills, but to actually solve the problem. In this case, should you quit your job or should you stay? So they start by saying, okay, let's break. First decision, what creative tool do we want to use? We can use paint, we can use crayons, we can use pencils. You choose. And then you say, I'm going to use crayons. Great. What's the next? What are we going to draw, say, with our crayons? Do you want to draw animals, landscapes, or just something abstract? And through that process, you're learning how to solve a problem, but then you're also going, okay, so what are the steps in deciding, should you quit your job or should you stay? Art, in this case, is facilitating that process and that conversation. So you're learning a basic skill, like problem solving, but you're also solving the problem that you're in therapy for. And see how art facilitated that and made that possible. So that's the process of art therapy, but who's practicing art therapy? Who's administering art therapy? Let's talk about who practices art therapy. Art therapy, or the title art therapist, is usually a protected title. Ironically, at the time of recording, just a couple days ago, I did see like an ad for a course that said, we'll train you in art therapy. And the course said, we'll train you in modalities and considerations of art therapy, but this does not make you an art therapist. So this depends on where like the governing laws and what the laws are wherever you live. In Ontario, anybody can learn art therapy, but it takes a special designation, it takes special education and continuing education to call yourself an art therapist. So here in Ontario, art therapist is a protected, legally legislated title. That is very fancy speak for saying your art therapist probably had to go to grad school. So they had to go to university, get a degree, probably in art, psychology, or a caring modality like social work, and then go on to graduate training in art therapy, and then register with a body. In Ontario, it's the psychotherapists, the association, and then they have to meet those requirements. So in Ontario, psychotherapists have to do ongoing professional development and training. So practitioners of art therapy, art therapists, are highly trained professionals with a lot of university education and continuing education. Something I've alluded to, which is like, how do people come to art therapy to practice? It depends on your graduate training and what their requirements are. When I was looking into schools, because this is something I want to go into, I generally found one of two streams. You either have to go into graduate training from a social science background, so psychology, social work. Some will accept like sociology or anthropology, or some schools actually require that you come at it from an art degree, that you actually get your degree first and foremost in art, in studio art, and then go on to training to learn the psychotherapy component of it, and then integrate that. Because remember, a key part of this, of who practices art therapy, art therapists are trained in psychotherapy. They are trained almost the exact same way that talk psychotherapists are trained. But art therapists learn how to use art to facilitate the process. So then the other question I'm dancing around that I want to get to, which is, how does art therapy work? How does the whole process work? Well, in its most basic form, art therapy works almost the exact same way as talk therapy does. So consumers, we discover that we have a need for therapy. We get to know the therapist. They usually offer like a free, 15-minute consultation just to get to know them. If you decide to move forward with them, you then have a dedicated intake session where you truly get to know each other, but your art therapist is getting to know you, your needs, your goals, what your sense of well-being is, if there's any gaps in your well-being. Then you have sessions to work on whatever it is you want to work on, because most therapy is very client-centric or client-centered. So you, the client or the consumer, is kind of driving the bus and deciding what to work on and when to work on it. Most therapists don't have packages or where they require you to work with them for a certain amount of time. So you have as many sessions as you feel is necessary. And then therapy kind of works in terms of like seasons. So, your season might end and go, okay, I feel equipped. I'm ready to go. I don't need therapy. I don't need art therapy anymore. And you stop. And then you can go back to your art therapist whenever you need further support. With art therapy, though, and unique to art therapy, there's a few hallmark things that you can expect. First, you can always expect usually a verbal check-in on getting to know like where the person's at, how they're feeling, what's new, what's going on in their life, anything that they want to address. You can expect the use of creative materials in your sessions. So it's probably not just sitting down and talking to the art therapist. There's going to be some kind of artistic items around you. So there might be like Post-it notes, and you might be like doodling with pens, or you might like be painting. Something I've always enjoyed seeing when I meet art therapists and I see their offices is all the different like artistic supplies. And that's really, really cool. So you can expect arts and creative making to be part of the process. You should also expect generally very minimal direction in terms of what you should create or how you should create it. You might with your art therapist, and this involves some of their discretion in their training, but you might decide on materials, why you might use certain materials and not others. But otherwise, you usually tend to create whatever you want to create and then reflect on that afterwards. So don't expect to be told like, in today's session, you must draw a rabbit. There's not usually a lot of direction that way. Some therapists will differ in a few little details in their practice. For example, like how long is a session? I've seen some therapists who said like a session is 75 minutes, or a session, especially in art therapy, because with setting it up and taking it down and cleaning up, it's going to be longer. Some will say like it must be 90 minutes or it's 50 minutes. They may differ in how to end the session. So for example, I go to a talk therapist. My therapist lets me go over by a couple minutes. I know I've come to learn that she builds in wiggle room for going over. But I've also had therapists. I had one therapist in particular where I sat as the client, I know there was a clock position behind me on the wall, and she could see it, and she would actually reference the time, and she'd say, okay, so we're wrapping up in 10 minutes. So, and she would wrap up that way, and she had a firm stop at that time. So therapists will differ on that. Therapists may differ in how the session goes. So how much are you leading? How much are they leading? How much are they talking? How much are they listening? How much are they asking questions? What are they telling you? And the other big difference that you may see between therapists, and especially art therapists, are homework or to-dos, or things to do in between sessions. Some therapists will absolutely give you homework and give you a checklist of things to do, and they'll ask you about it at the next session. Other therapists will kind of just let you go. My current therapist, who's a talk therapist, and the last art therapist that I worked with didn't. They were like, no, show up to the session, and that's a fabulous start. If you want to do homework in between, awesome, but you don't have to. And with that, then let's kind of change gears and talk about like, what is art therapy good for? I know this is a commonly searched question. I've used art therapy for a couple different things. So what is it good for? Generally speaking, art therapy is good for anything that any other, like especially talk therapy, which is what we're most familiar with, is good for. Whatever talk therapy is good for, art therapy can be good for. It can be good for making big decisions, for handling mental health struggles, for handling life changes, challenges, anything that you would typically go to therapy for. If anything, I think it's actually more helpful to address what art therapy is not good for. And I can only really think of two big things art therapy is not good for. First, it's not really good for psychiatric concerns or where you would want to involve a medical doctor. Because remember, most therapists can't diagnose, they don't prescribe anything. So if you want a medical doctor to work on maybe the biochemistry of your mental health or your physical experience, or you're thinking about prescriptions or a diagnosis, because a diagnosis can open up other doors for you, then we would go to a different practitioner. The other thing I would say art therapy is not good for is environmental concerns, anything affecting your environment or your survival as a human. So, for example, like we know in mental health, like a lot of external things can affect your mental health. Let's use housing, for example. If you don't have stable and secure housing, your mental health is more likely to suffer. An art therapist in an art therapy session can't get you housing. You would be better off to go to maybe a social worker or to go to an agency or to go to someone or an entity that can help with that. An art therapist can't really help with that. So when it's psychiatric or when it's environmental in nature, you may need to go to another practitioner. That said, let's wrap up with some myths and some common questions about art therapy. First, a lot of people ask, how much does art therapy cost? This varies wildly. I would say, based on all the research that I did, my experiences with art therapists, if you need a benchmark in Canada and the US, I'd say plan for about $100 Canadian or US per hour. Next, do you have to be good at art to do art therapy? No, you do not have to be good at art. Art is available to everyone. Everyone, humans, by our very DNA, are creative animals. We create. That is something we inherently do. So art and the creative process is available to everyone. No, you don't have to be artistic. You don't have to be an artist to do art therapy. On a side note, I would actually personally argue that if you are a professional artist, if you do consider yourself an artist, if you're trying to be good at art, that might actually impede the success of the process, because you may spend more time thinking and feeling your way through creating something beautiful and not using the art to express and reflect on whatever it is you're working on in art therapy. But no, you don't have to be an artist. You don't have to be good at art to be in art therapy, to work with an art therapist. Do you talk during art therapy sessions? Yes, you can't get away from it. You may not, and I want to emphasize that, talk as much as during a talk therapy session where almost all you do is talking. Is art therapy good for people on the autism spectrum? Generally speaking, yes. The same way that talk therapy is good for anybody on the autism spectrum. Here, though, I might recommend working with an art therapist who has training or experience in working with folks on the autism spectrum. That comes down to kind of training and experience. But generally, yes, it is just as helpful for people on the autism spectrum. Can art therapy help kids? Can it help adults? Yes, it absolutely can. Most art therapy is tailored towards, and I know when I was looking at the curriculum for art therapy schools, a lot of the schools tailor it towards kids, but art therapy can be just as effective for kids and adults, for people of most ages. And I say most ages of people who would seek therapy or therapeutic services. Next, and this is a big one, is art therapy effective? Does it work? That is a big loaded question. Generally, I'm going to say yes, though. Art therapy, it's as effective, generally speaking, as other therapies, and especially as talk therapy. It is, and we know that because it is evidence-based. And this is how you know it's a controlled act, is because we require something called evidence-based practice, meaning you can't just guess at what someone wants, or you can't just go based off your own thoughts or feelings. You have to, an art therapist, go based off of well-documented research and case studies and training based on what has worked with hundreds, if not thousands, if not millions of other people. Remember, art therapists are trained in theory, research, and practice of using art therapeutically and in psychotherapy. And a lot of that is based off of theories and hypotheses that were tested in controlled and as safe as possible environments. So, is it effective? Yes, it's as effective as most other therapies. And I only say most others because I can't confidently say that it is. I haven't done that research yet. But yes, because it is evidence-based, because it is tried and tested on many others. The final big question that I saw about art therapy is art therapy covered by insurance? As always, you have to go to your insurance provider. I think most insurance providers or insurance plans that offer psychotherapy do cover art therapy and art therapists because they are registered. I know, here in Ontario, they're registered as psychotherapists. Psychotherapists who are accredited can take benefit plans and insurance. So generally, yes. but always check with your insurance provider. And that is an introduction to art therapy. Some key things to know when it comes to art therapy. 1, you do not have to be good at art to do art therapy. Some art therapists go to schools that require a studio art degree first. So if that's the case and you find that out, then chances are your art therapist is an artist first and then a therapist. And some are trained first as therapists and then pick up art later. Both work. But you, the consumer, us consumers who attend art therapy and seek out art therapy services, we don't have to be good at art to engage with art therapy. Second, I think it's important to know that art therapy is a really cool alternative to traditional talk therapy. If you don't love the idea of just sitting on a couch or sitting in a chair and talking to someone an hour at a time and just talking about problems, art therapy is a cool alternative. And then I would say finally, it's important to know that like art therapy can help for anything that you typically go to therapy for. So if you're struggling with your mental health, if you're wrestling with addiction, if you're struggling to make big decisions, art therapy can help the way that other forms of therapy can help. Comment and let me know, what are your thoughts on art therapy? If you've experienced art therapy, what's that experience been like? As always, make sure to like and subscribe for all things mental health, school, business, life. Otherwise, we'll chat soon. Bye for now.